Hello and welcome back to Focus Atlanta. Thanks so much for continuing to watch. We're going to close out the show with a very important topic. You know, I think it's really important for us to consistently have conversations about mental health because mental health is health. Well, today I'm here with Dr. Zoe Martinez, and we're going to talk a little bit about the link between ADHD and mental health. Thank you so much for coming on the show.
Thank you for having me.
Absolutely. I got to say, Dr. Martinez, I've never really considered the fact that people don't consider ADHD and a link to mental health. What should we know?
So ADHD is one of many diagnoses that are, as you said, impact people's mental health. It is an illness. It is very treatable in a variety of ways. And people with ADHD often have other mental health issues as well. So it's very important for them to take care of this issue, which often impacts people's academic, personal, social, and occupational functioning. But sometimes people also have other more common mental health issues such as anxiety and depression that sometimes go along with ADHD.
So often when there is like I guess a co-diagnosis in terms of, you know, that patient finding out, you know, is it one that's driving the other per se?
So, I mean, it depends. So many times people, so I'll finish this. Sorry. Children are often diagnosed with ADHD correctly because it's commonly recognized as a disorder of childhood. But adults sometimes have had it, but they didn't ever get it diagnosed. So it may be driving their depression and anxiety because they kind of feel like failures chronically because they never got their ADHD treated. So they're not doing as well as they could be in other aspects of their life. And then they start to internalize it themselves as feeling, you know, whatever, stupid, lazy, all of those things. And then that drives some of those other diagnoses.
Wow, now that's critically important that, you know, so often for adults. And I think that, you know, to some extent it's generational. There were misdiagnoses or, you know, things that we didn't catch a little earlier just because we didn't know better, right? When you know better, you do better. So in terms of, to your point, taking care of our children, if our children have been diagnosed with ADHD, should there be extra steps that we take in terms of making sure that their mental health is taken care of as well?
So, I mean, I would say the number one thing, if it's a child, make sure that the parent knows that there are resources in the school. Again, I know everyone jumps to medication since I'm a psychiatrist, but there are lots of other things besides medication, getting extra time for tests, sitting closer to the teacher, getting an IEP, for example, that's protected under the Americans with Disabilities Act, and the parent just needs to write a letter to request that. So the earlier we recognize it, the better, and the less a child or adolescent will internalize feeling like they're just not good enough, they're not smart enough, they're not fast enough. So yeah, the earlier the better.
Oh, and you read my mind because I was thinking, you know, how is it ever too soon in terms of children? You know, are there children out there, you know, who are 10, who are, you know, very possibly struggling with ADHD and we don't know because we're thinking, oh, they're just kids, you know, we don't have to take those precautions with them. But is there an age range? Are children?
I mean, I don't. I think sometimes no. I don't. There is no age range that's too young. When people look back, sometimes they're like they were getting in trouble in preschool or kindergarten.
Wow. Okay. That's
and sometimes people just say, well, they're not well behaved, or which can happen. Obviously, children can choose that. But sometimes it's like if a kid really can't sit still, or if they're really not finishing their work and they're just looking out the window daydreaming. It's worth asking about, and I don't think anyone wants to feel like there's something quote wrong with them, but it's not a big deal if you recognize it early.
And again, you know, I'm glad that you said that sometimes people think there's something wrong with them, but again, mental health is health. There's nothing wrong. You just need to get the help that you need to, you know, get over that hump or get over that, you know, whatever is holding you back.
Thank you so much for saying that. Like, yes, if your kid had allergies or they had something else, you would just take care of it, right? It's the same.
Absolutely. Well, is there a place, you know, for Dunn where we could go on a website and learn a little bit more about, you know, what we should be looking out for, things that we should perhaps pay attention to?
So the company I work for, Dunn, does do some of that. There's a quick assessment, but there are other places as well. And actually, if you have a child, most pediatricians' offices can probably give you like a simple Conners scale that a parent and a teacher can fill out. You know, pen and paper, really cheap. Most pediatricians' offices have them, And that would be a place to start. Just, I mean, all you're doing is answering questions. No blood, nothing else involved, just, pen and paper.
Oh, that's phenomenal. Thank you so much for shedding light on this topic and making sure that we're paying attention to our mental health, just like we would, like you said, an allergy or physical health. It was a pleasure to meet you.
Thank you. You too. Thank you for saying mental health is health. I appreciate it.
Absolutely. All right, guys, all of us need to take care of our mental health because, again, if we had diabetes, we'd be taking care of that. So take the opportunity to really recognize that your mental health is just as, if not more, important as your physical health. Thanks, guys, for tuning in to Focus Atlanta this week. I hope to see you next Sunday here on WUPA.